Ladies, hand pain and thumb pain can steal your independence as you age. I'm in the thick of perimenopause right now. I'm sure if you're my age, I'm turning 50. If you're my age, we're all talking about perimenopause and menopause. And the reason why it's so important is because as women, sometimes we neglect our own health because we're so busy taking care of everyone else. The thing is that we live long, right? We live long, and then we're going through all this crap, which is perimenopause and menopause. And those things affect our hands. And if you want to live independently and you want to have quality of life, let's take care of your hands now in your 40s and 50s and 60s so that you can imagine when you're 70s and 80s, you can still drive, you can still open containers, you can still live alone, and you can still do a lot of stuff on your own, right? My name is Huang. I'm an occupational therapist and certified hand therapist. I have a therapy clinic located in Miami, Florida. If you're here in this area, you need my help, let me know. If you're looking for an online consultation, links below, reach out, my team will help you. I want to share with you some things that you can do to take care of your hands today. And I'm not just talking about like adaptive stuff like, oh, use Dyson. Yes, go ahead, use Dyson, because opening really hard jars can tear away at your hands. I'm a therapist. I've been a therapist for over 25 years, working very specifically with hand and arm injuries. And I can tell you right now that one of the things that I am always doing, and I teach therapists and I teach them the same thing. I've got to protect my hands. I've got to protect my thumb, because the thumb does 50% of the work of my hand. So without my thumbs, I'm dead in the water, right? Without my thumbs, I can't be that effective. And there's nothing that you do in your life that doesn't require your thumb. You want to drive, you want to open a door, you want to close a door, you want to cut, use scissors, write, all of that requires your thumb and your fingers, right, to be able to work. If you're in your 40s and 50s, here's the thing with like hand issues that I've been talking about a lot. So I want to bring that to your attention. Some hand issues come from the spine, they come from the neck. I've been treating a lot of people here in my clinic with hand and thumb problems that come from the neck. And so one of the most important things that I can do as a therapist is to help figure out the root cause of the problem. I'm sure you heard it and you're like, no, root cause of the problem. Okay, I know. But if you come in, I've had patients come in. If you come in and you're like, Huang, my thumb hurts here, only treat me here. If I find out that the problem is somewhere else and you don't let me treat it, I won't be able to get you the help that you need, right? So here's a couple of things to think about. This is just for your information. Find a therapist in your area. Find somebody who you trust that can help you to help figure out what's the problem. In the thumb, we have 3 bones. We have this little bone, this middle bone, and this really long bone. This long bone sits on top of our wrist bones. We have 8 wrist bones, right? And it sits on top of it. So when your thumb hurts and it hurts back here, it's not just your bone, but it might be a tendon. When it hurts here, right in here, this specifically sometimes is coming from a neck problem. Sometimes it's coming from muscle issues. Like, we have to figure that out, right? When it comes to the thumb, everything that we do with the thumb, because it sits on top of the wrist, affects everything we do with the wrist affects our thumb. So if your thumb hurts and you're trying to figure out and stretch it on your own, I want to share with you how to be mindful of your thumb, because the muscles that go to your thumb actually end here, but it started up here. So it starts in the middle of your forearm, it comes across your wrist, and it takes a little dive over to the side. It takes a little sharp turn, and then it has to come and sit right here. Then it comes, and this big one helps it to bend. And then we have an opposite one that starts out here, comes across, and it starts right here, ends right here, and its job is to help move the thumb up. What we want to be is, because both of those big muscles move across your wrist. When you're doing anything with your wrist, be mindful. If you're doing anything for your thumb, be mindful of your wrist. So I'm going to show you something that I teach my patients all the time. I move my stuff out of the way so I can move it so you can see when you're stretching your thumb, right? Oh, let me tell you what normally happens with thumbs. Because the way we work and use our thumb likes to fall into our palm. This is our palm. This bone likes to fall inside. It's just anatomy. I'm not going to go into this whole anatomy lesson, but that's the way it likes to fall. Because it likes to fall that way, we have to help it come back up. And it's not directly back. It's kind of like back into the side a little bit, right? Back into the side. So if you want to help yourself, right? Like normally I recommend if you have hand problems, like go find yourself a good hand therapist, because if it's hurting one hand, it might hurt the other hand. So when you have a knee injury, your toes hurt, whatever, you have both hands to help it. When you have a hand or thumb problem, you have to use your other hand or thumb. And the other hand or thumb is doing everything it's already doing and more, because this one doesn't want to work. And then you're going to make it work extra. It's just problematic. But I'm going to show you anyway, because maybe you can do it and it'll help you. But if you've been trying it and trying it and it doesn't help, like find you some good help. So we want to pull it back and out, so it's kind of at a little bit of an angle. Okay, I like to use a flat surface, a table, and then what I do is I like to put it under see this line right here, see the crease of your thumb? I want to put my fingers in that line and I'm going to pull it out and then up, right? It's very gentle, very gentle. I teach this to my patients and they're so aggressive because they want to just fix it fast. Less is more, right? You're going to put it underneath and you're going to pull up with your hand and push down with your wrist, right? Pull up with your hand and push down with your wrist. There you go, just like that. It's very small. And then you're just gonna hold it, just hang out there for a few seconds, and that's gonna help put that back into its socket, okay? That's one way I like to stretch that thumb. And then the other way is I wanna put my elbow on the table. Oh, hopefully I'm not ashy today. I'm gonna put my elbow on the table because I wanna remember your thumb sits on top of your wrist, right? So I'm gonna use my other hand to cup, and then remember, you can't just jam it and push it down. You have to kind of pull it out a little bit. You know how like back in the day when they had hitchhikers? Oh my god, I saw a hitchhiker the other day on the side of the street and I hadn't seen one in like decades, and she was out there with her thumb up. Okay, that's what we want, right? Thumbs up. That was a side story. Thumbs up. And you want to put this thumb space in between each other, and then you're gonna just pull that thumb out and back. And because it sits on top of the wrist, don't forget, you can stretch your wrist a little bit. So you're kind of like on top, and you're just going to stretch it a little bit, right? And then while you're stretching it, you can open your thumb, right? Open your thumb, open your thumb. Don't worry about bending. Here, that thumb, we have extra thumb muscles that help us bend, and we have this big one that bends. You're going to be able to bend it. You want to be able to open it first, and opening it and making it straight will also help you to bend better, right? So as you're stretching it, you can just move that little tip, bring it up and down, up and down, up and down, right? So don't think about just stretching it, but really think about like moving it as well. And movement in the right direction will always help you. So we often think about always like, oh, I need to make a fist, but you'll be able to make a fist better when you move all the opposite muscles to make it move better in the opposite direction. So that's for your thumb, and that's going to help you get rid of some of the pain that you have. Now, again, I'm just sharing with you some general things that I teach my patients. Depending on what your problems are, you might need something a little bit more specific. And this is where I really recommend if you have hand issues, like you just got to go find yourself a really good hand therapist, a certified hand therapist. They are like, as certified hand therapists, we bridge that gap between like instead of just going to a massage therapist, right? Instead of just I love me a massage. A good massage, they'll make you feel really nice. But when you have a medical issue, right? You know, like maybe your joints are not sitting in the right place. Who knows what, your diagnosis really is. Maybe something is pinching that is in your neck and not just in your hands. Your therapist will be able to help you figure that out so that when you fix a problem, you can go and enjoy the massage, right? In therapy, my patients tell me, oh, it feels like such a great massage, but I'm just moving their joints and fixing their muscles. I'm not really like sitting here just massaging. I'm like moving some tissues, okay? I'm moving tissue to help you stay more independent and not have thumb pain. It's a very important thing to me as a hand therapist, something that I not only do for my patients, but I teach other therapists as well. So that's your thumb. What else can I show you? For your fingers, right? For your fingers, one of my best things that I can share with you is we have little inside muscles and then we have outside muscles, right? So we have little itty bitty muscles inside and they sit in between our bones. We have these bones, they're called metacarpals, right? Just like you have a long one over here, you have a long one in each of your fingers. You know, we have little muscles in between that. We have little muscles right here in between here, and then we have them in between each of our bone. Now, you can sit here and massage. One of the best ways to massage is actually not to just use your finger, but I teach my students, my therapists, I teach them you got to come from the side with your finger. You come from the side, and they're very small, so if you massage on this side or you massage on this side, you're going to catch those same muscles, right? So you can do that to yourself a little bit. You can use, some people use an eraser, but that's just, you know, it's not going to fix the problem. It's just going to feel really nice. What happens is a lot of times, because you're constantly making a fist all day, and here's my little 2 cents. I'm not a big fan of squeezing with a ball. I know everyone and their mother's like, squeeze a ball, squeeze a ball. That is only for if you're trying to strengthen, right? If you're trying to strengthen. That will not only strengthen your hands, but it's the purpose is to strengthen your forearm. So if you're athletic and you want to squeeze on a ball and stuff like that, it's great. But if you lack motion and you have pain, then squeezing on a ball really defeats the purpose of what you're trying to solve, which is to get more motion and get rid of your pain, right? So do what you will. But every patient's like, I have this exercise ball. I'm like, okay, not for your problem, right? If your problem is that your hands hurt because your muscles are really tight here, here's what happens. When your muscles are really tight here, you'll have pain on these knuckles and maybe even these little knuckles. This is just anatomy, right? This is just what happens. We have inside muscles that can cause tightness. Those muscles come and they come onto the sides of our knuckles. That's where they end. Who knew? So when they are really tight from all your ball squeezing, right, you need to make them long and stretch them. One of my best moves, I teach this to my patients, I teach this to my therapists, like on my other platform. If you're a therapist watching and you want to learn Hand Therapy Secrets, that's where I teach. So fingers in between, and you want to find the in-between bones, right? In between bones. And all you're going to do is give it a little squeeze. The little squeeze is because you want your big knuckles to go back into what we call hyperextension, right? So we're going to do that. This is not good for everybody, but most people this is really great for. So use at your discretion. This is just for educational purposes. So we're going to go back like this. And because those muscles, they actually start in the wrist, when that feels really good, then what you want to do is you want to bring that wrist back and then pull that big knuckle back